you, colleagues. Good morning. So I'm Emmanuel Makasa, as introduced. I lead the SADC, Southern Africa Development Community Regional Collaboration Center, and I also chair the Technical Experts Working Group. So the Technical Experts Working Group obviously has got state actors and non-state actors in their full definition, which includes private sector. So we provide technical support and policy framework support to the member states or the countries. As you know, countries are very committed to try and improve maternal health as part of the bigger picture. But those political commitments need to be translated into something that actually touches the woman that needs it the most. And so we guide the countries to develop their national surgical obstetric anesthesia plans. They can be called anything else, but basically it's surgical plans, surgical healthcare plans. Now, these plans obviously are policy frameworks that provide space for all the actors to play a role in providing care to those that need it the most. And obviously the governments have to lead because they're the owners of the programs and the people, and they have to make the initial investments. But obviously these plans, like we said, are and usually prioritize maternal health and children's health for obvious reasons. And they are really important because in the past in health, we've mostly invested, we've mostly focused on, public health. And we've always left out the clinical aspect of this, which is really critical. And so, for example, if we apply this to what we do in terms of the policies we create, and I'll give the example of the Zambian policy that was formulated, I think, from 2017 to 2021 is being revised. The driving force behind that was really the statistics that came out of women's health. As we were getting towards 2015, the assessments of our targets in the Millennium Development Goals on maternal and child health were really, really bad. And one of the key weaknesses we had while we were not meeting those targets, even reducing maternal mortality, for example, was the lack of access to surgical care that are actually required for example, if you want to, issues of cervical cancer, you need to biopsy. If eventually a woman has got cervical cancer, if you're going to think to do anything, you have to have a tissue biopsy. Breast cancer is the same story, but the biopsy capacity or technical capacity to do that at the district hospital facility is not there. And so how do you improve that? Because, before you can even talk about the medication you can give them or the radiotherapy or anything that you can do, you need to know that it's actually this particular cancer, and surgery then comes into even that aspect. Around childbirth, mothers usually die because of bleeding. Again, you can't stop bleeding with a paracetamol or a tablet. You have to use some surgical instruments to, whether it's a laceration or a tonic uterus, whatever it is that you want to do, or a hysterectomy, it's a surgical intervention. So these also obviously provide very good entry points, but the governments have to structure. The policy then structures the roles that the government will play, the role that civil society will play, the role that private sector can play, to all of us then co-invest and actually have meaningful impact for the investment that we make. Obviously, these policies also have very good inbuilt monitoring and evaluation systems that can then demonstrate, first of all, monitor the progress of what you're doing, and then, of course, demonstrate the impact of the investment you're making. Impact in what? Well, we have to gather evidence of the impact of how do you strengthen the health system. We believe surgical care systems are cross-cutting. They are not horizontal. They are not disease-specific. They'll have impact across the whole health system, across all levels. And then we also want to see impact on the health outcomes. We want good health outcomes. We want to reduce maternal mortality. We want to reduce infant mortality. That obviously can be impacted. And then, of course, we want to see the socioeconomic impact on the person that's involved, the family, and the community. And it's true that these are very good entry points. Maternal child health are very good entry points because obviously mothers and women drive the economy. Even when children are involved, it's the mother who bears the brunt of having to take care of that child, whether it's congenital abnormalities, whether it's trauma. And so for us, we believe that surgical systems are a very good area to invest. But of course, the investment can only make meaningful impact if it's structured with the country, and the country has to lead to provide that framework, that policy framework, and create the space for the others, non-state actors, private sector to actually invest.